$280 billion. That's right, $280 billion. That is the financial that's the financial burden on the United States annually. It's a burden on our economy in the amount of $280 billion. And we're going to talk about it, as well as talk about how creating an affordable, culturally responsive mental health network might help. And we're going to do that in just one moment. Hi, everybody. You are inside of Stress Talk Live. This is the place where we help women over 40 live healthier lives through strategic stress management and solution-focused self-care. I'm Marcyline Bailey, and I am your host. I'm so glad that you joined me today. We're talking about, because this is Mental Health Awareness Month, we are talking about mental health concerns. Yay! And today I hope to share with you just some information that will be helpful to you and enlightening. Before we get to that, I want to remind you to please like, follow, and subscribe to Emma Bailey Consultants on Facebook, Instagram, and YouTube. You'll find the replays of our Stress Talk Live episodes on both Facebook and on YouTube. I also invite you to go to this tap link. This is where you will find the link to sign up for our weekly newsletter, which comes out on Wednesdays following our Sunday episodes. And our newsletter has announcements. In this past newsletter, I announced that the stress workbook entitled The Ultimate Stress Busting Guide is now available for download. I invite you to go check that out. Also, you will find information about our Grateful Gatherings. Our next Grateful Gathering is on Saturday, May 31st. You are invited. This is a free event. Sign up at the link in the newsletter and you'll get all of the information in the material. What else? Oh, also in the newsletter, you'll get the replay as well as a transcript or summary, I should say, and also a PDF download. So you'll have access to that in the newsletter. And that comes out weekly. Next. Here's the website, my website. Please go there and you'll learn a little bit more about me. So let's get into our topic for today. Our topic for today is how to create an affordable, culturally responsive mental health network. This is important, I think, because the cost of mental health and the financial burden on our economy is so great. As you heard in the opener, I said $280 billion. 280 billion, not million, not thousand, not $280, but $280 billion is the burden that's on our economy when it comes to mental health. And what that looks like, I'm going to go over the cost, but what that looks like is, and I'm not saying that because of different cultures, it's that burden. I'm talking about in total, there's that burden. I believe that when we do unto the least of these, then everybody benefits. And so I think it's incumbent upon us to really look at that, our mental health system overall, and to begin to provide culturally responsive um, healthcare. And when I'm talking about culturally responsive, I'm not talking about just race. I'm talking about race. I'm talking about gender. I'm talking about region. I'm talking about um, belief systems, culturally responsive. So it's we're not just talking about black or white. We're not just talking about um, country of origin versus the United States. We're talking about being able to meet people where they are so that we can provide the best available mental health care that we can. And if we do that, we can save billions of dollars and decrease the burden on our economy just the same. So let's talk about costs. And I'm going to talk about direct and indirect cost for a moment, if you don't mind. And the information that I'm sharing with you um, is from, um, I'm sorry, I just blanked out. just blanked out. It's from the Campaign for Trauma Informed Practice and Policy. And this information is based on a study that was done in 2024. So when we're talking about costs, there are two sets of costs that we want to consider. One is the indirect cost. And when we talk about indirect costs, we're talking about things like lost productivity, okay? We're talking economic productivity, that is. And so we're talking, when we're saying economic productivity, I keep moving my notes around. So if I'm looking back and forth, that's why. When we're talking about lost economic productivity, we're really talking about that how when people have difficulty with mental health in the workplace, where places where they work, it's hard for them to attend to their job, right? Um, we know that mental health treatment is the most expensive health care cost that employers have. And we know that healthcare is the cost of healthcare is remarkable here in the United States. Our employers, if you're employed, the employer pays a substantial amount for your health care, and you pay a portion of your health care. But as we know, the cost keeps going up. Mental health treatment is extremely expensive. Why? I don't know. But it is extremely expensive. And what you will find is that employee sponsored health care or health insurance doesn't always cover mental health treatment, including outpatient. We're not just talking about inpatient, we're talking about outpatient. You will find that your insurer, if you're employed, your employer sponsored insurance will only cover after you've met a deductible, or they don't cover it at all. Now, in some instances, your deductible could be thousands of dollars, right? And so until you pay those thousands of dollars in your deductible, they're not going to cover your mental health care. You're going to have to come out of pocket for that. Also, when we're talking about lost economic productivity, we're also talking about how it can increase absenteeism, it can decrease focus, it can stop innovation. People aren't able to think or use their cognitive ability when they're having mental health struggles. And again, when I'm talking about mental health struggles, I'm not talking about um, someone who has a debilitating mental illness. I'm talking about people who may have anxiety, depression to a certain degree, right? I may be talking about people who have um, other mental health concerns, but it can affect their ability to work, maintain a job, or just attend to their work while they're at work. So lost productivity is a direct cost that we can measure, right? I talked a little bit about the cost of and mental health treatment, but when I'm saying mental health treatment, what are we talking about? Therapy, medication, and possibly hospitalization. Sometimes people who have a mental illness require hospitalization in order to be stabilized, right? All of this costs money. And if your insurance company doesn't pay for it, how are you able to cover? How are you able to use the services? We also know that when individuals have comorbid physical illness or conditions, as well as mental illness, when they have both, it there's a greater effect on them physically as well as mentally. So when we talk about direct costs, we're talking about mental and physical health treatments and even access to such. Other direct costs, we're talking about increased usage of human services. Um, and what does that look like? When individuals who have a disability are unable to work, then there's an increased reliance on supplemental security income or Social Security disability programs. These are the costs are huge. And yet we have thousands of people, hundreds of thousands of people who rely on those supplements and that disability here in the United States. It's really not something that we can get rid of because people rely on it. It helps them to live and helps them to live with, with dignity. And it helps them to remain safe and healthy as much as possible. But the cost of that is very great. Also, people with mental illness, extreme, severe mental illness, are at risk for housing insecurity and instability. Um, about a third of the people who are unhoused, some of you may use the term homeless, but people who are unhoused, about a third of them have a mental illness. So when you think about that and housing instability, that cost again is great. And those are people who would need human services, your social services, right? Also, there are family members who provide care and see about individuals who have severe mental illness. Well, oftentimes they have to take off work in order to make sure they're going to their doctor's appointments. If there's a crisis, they need to go and attend to the person. And so they're having to take off work. All of these are direct costs associated with mental health. Well, what are some of the other costs, some of the indirect costs? Well, there's reduced consumer spending. Individuals who have mental health issues are not making money, and so they're not spending money. They're not buying goods and services, which helps to keep our economy going. There are also impacts in terms of education and training. If a person has a severe mental illness or mental illness where they're not able to attend to the training or their education, There's an increased rate of dropping out. There's an increased rate of not finishing the training. And then these individuals may have difficulty being employed. There's also a cost related to crime, mental health related crime. In the community in which I live, our sheriff's department has been asking for assistance because many of the people who are in jail, that he's holding in jail, are there because of a mental health related crime. These are individuals who probably would be better served in mental health treatment as opposed to just sitting in the jail waiting for their hearing, right? So there is a cost because of crime. And these are small crimes. These are not major crimes. These are small crimes if there's such a thing as a small crime, right? When I say that, I have to add that condition if there is such a thing as a small crime. And then we also know that people who experience mental illness are more susceptible to crime. They're more often the victim than not. They're more often they're more often susceptible to being abused or neglected. Those are all. These are all indirect costs. And then what about impacts on the weather? As it relates to extreme weather, people who are unhoused, people who have mental illness. We know that a third of the people who are unhoused have mental illness, um, are at risk because of the weather, because of the climate. Again, where I live, it is getting hot. At 8 o'clock in the morning, it's like 80 degrees already. Okay, maybe 77, but it'll be 80 by 9 o'clock in the morning. And so there's the heat, the cold in the north, snowstorms, hurricanes, tornadoes, all of these weather impacts affect people who have mental health concerns. So what does that have to do with what I'm talking about today? Well, I'm talking about how it's important to consider culture when developing a responsive mental health network. And again, I will say that when I'm talking about culture, I'm not just talking about race. I'm talking about ethnicity. I'm talking about beliefs, religious beliefs, spiritual beliefs. I'm talking about regions. I'm talking about gender. I'm talking about all of these things that we label as culture. It is very, very important. One of the things that's extremely important, and what you'll see when it comes to mental health treatment, is that there is a requirement. I'm sorry, let me go back. Codes of ethics for individuals who work in mental health have all included a requirement that individuals who work in mental health must receive training around cultural competence. Now, I have a bias about the training that we often see around cultural competence. And one day I think I'm going to just develop my own training, because oftentimes trainings on cultural competence only deal with race. Well, cultural competence is not just about race. Because even if you're talking about race, you really have to talk about race and all the nuances around that. Because here I am a Black female who grew up in Cleveland, Ohio. When I moved to the South almost 30 years ago, I was amazed because other Black women, other Black women who I now know, have known for almost 30 years, I felt like they were so different from me and what they thought, how they behaved, their actions, their mannerisms, and they thought the same about me. So when we talk about cultural competency, we can't just lump everybody into a bowl and say, you all are the same, because we're not. There are going to be similarities in terms of our history, similar, but not the same, similarities in terms of our history, in terms of our beliefs because of our history and how we're raised. However, there are going to also be differences based on where we grew up, the interactions we had growing up, and our other experiences, right? Where we went to school, who we were exposed to, what we were exposed to, our exposure to the world. All of that plays into who we are as individuals. And so when we talk about cultural competence, we also need to be aware that one size doesn't fit all. We can have a framework, but we cannot put everybody in that box and say you're the same. That is why I think we need a culturally responsive mental health network, because we have created this network, these services, and we've just decided everybody fits in that box. And what we have should work for everybody. And that everybody looks different, because the research that was used to create this mental health network, this mental health system that we currently have, did not include diverse cultural considerations. And that's part of what we have to progress. Ooh, shall I use that word? We have to grow into creating a system that has a framework around culture, various cultures, but continues to treat individuals as individuals. So, cultural competence, making sure that people who work in these settings are culturally competent, not just in terms of race, but in terms of all of the other things that make up culture as we see it. Yeah, I think I will do a training. I think I'm going to develop a training on that. Okay. We also want to make sure that we have responsive, culturally responsive virtual networks. And this goes past just the telehealth platforms that many providers use. We're talking about support groups that are accessible virtually, making sure that there are digital hubs of resources that provide culturally relevant mental health information. If I am from another country, I don't speak the language, but I'm in this country and I'm feeling anxious, or I'm feeling depressed, it would be really nice to be able to go to a hub a website using my phone and finding what I need in my own language so that I can get the help that I need. Does this exist? Yes, it does. How long it's going to exist? That's a good question. But we want to make sure that that it is accessible, that people can get to it, and that it's responsive. We also need to consider that when we're talking about cultural competence, we need to also look at cultural competence in the larger community. So often we still view people as living in the same neighborhood, living in using the same social systems, where culturally we're very integrated now. We're quite integrated. And so we need to look at that as part of this network, creating partnerships with institutions so that we can provide comprehensive, culturally responsive care, training our primary care physicians to know how to connect to that network and be a part of the network that provides culturally competent, culturally responsive care. And also providing flexible service delivery models so that the woman who works a job from 8 until 4:30 can get her child to the doctor without having to take off work. Making sure that we have service delivery models in place so that there are evening hours offered or Saturday hours offered. One of the things that I do in my private practice is I offer evening hours for people who work a 9 to 5 job. And I also offer Saturday morning appointments. And that fits, that works well. We have a veterinarian who actually sees our dog and our cat. We have a veterinarian who does the same, offers weekend hours. Saturday, Sunday, you can get a Saturday, Sunday appointment to get your dog's nails trimmed, or you can get your dog their shot on Saturday or Sunday, because that works. That helps me who works all day, every day. My husband who works all day, every day. We can't take off to take our dog to the vet, but we can take him to this particular vet because her hours are flexible. Her service delivery model accommodates us. When we're talking about cultural competence in the larger community, we need to also consider the service delivery models that we have in place so that people can access the care without contributing to the cost, the financial burden on our economy. Finally, we also need to look at those social determinants. And when I'm talking about social determinants across our environments, because those are the things that influence health and well-being. And these are the non-medical factors: housing, education, employment, that all influence our health and well-being. And we need to be culturally competent and culturally considerate of these things and how it affects health overall, but also how it affects mental health. It affects mental health in an extreme way. I know I kind of ran through these fast. I know I talked about, I spent a lot of time on cost, and I have a lot of notes when it comes to cultural considerations. For those of you who are get my newsletter, you will get these notes. You'll get my summary and you'll get the PDF download that includes my notes so that you can review them outside of Stress Talk Live. What we've been talking about today is how to create an affordably, culturally responsive mental health network. I reviewed direct and indirect cost, and I also talked about considerations across cultures that we need to be aware of. I want to invite you to join me next time. Um, the holiday is coming up, and I will be off next weekend. And I'll put out a note so that you all know that I'll be off next weekend. I want you to enjoy your holiday. Rest up, rest because summer is here. You're going to be out playing. I'll be out playing. I want you to join me out there playing. But for now, sign up for the newsletter. Take a look at the stress workbook, the ultimate stress busting guide, and I hope to see you next time. That's all for now. And as always, take good care.